All right, so we're moving on to chapter 36. Again, this material came from week 12. It was the content that was covered after the test, and so we're doing a quick overview. This is self-study material. Please post any questions on discussion board or bring them to class, and we'd be happy to help answer some of them for you. Okay, so the medications we want you to know for PUD, pelvic ulcer disease.
Not pelvic, peptic.
Sorry, peptic.
Yeah, we're not talking pelvic right
Whoops.
now. No, pelvic. Wrong class.
Yeah. Okay, so we've got Zantac or ranitidine. We have Losec or omeprazole. I say that wrong.
Omeprazole.
Thank you.
Yeah.
Aluminum hydroxide or Amphagel. And these are medications we want you to be familiar with from this chapter.
I notice it says Amphagel/others or comma. So there's going to be more antacids that we want you to know about.
Right. Okay, so I'm going to flip the page. Anything that we want them to know. They learned all about the normal digestive process over in.
We're not going to do that.
No. So that's all anatomy and phys material. We do want you to understand the term esophageal reflux, also gastroesophageal reflux disease. But we're not going to get into the chief cells, parietal cells, or intrinsic factor for this chapter. Peptic, not pelvic, peptic ulcer disease. You can read for your information here. Here's some of the associated risks. Close family history of the disease, blood group O.
I find that interesting.
And me too, because that's such a gold standard of blood that we look for them.
And
then all of a sudden
what is it about being a type O that causes you to be at risk for PUD?
That's a good question. I wish I knew the answer to.
Well, we need to
smoking, obviously smoking, which might be linked to stress, because stress plays a role on damaging these things over here, causing erosion. Beverages containing caffeine. I'm in trouble.
Oh, dear, me too.
Drugs, particularly glucocorticoids, ASA, NSAIDs.
Oh, Lord,
Wait a minute. All these drugs we've been talking about put people at risk for ulcers.
Remember, and every time we talked about ibuprofen, we said, you need to take it with food, take it with food, take it with food. Here we go.
Yes, and watch out for signs and symptoms of any kind of internal bleeding or stool changes. Yep. So if they don't monitor their stool color, that's something they might want to think about doing.
This is true.
Excessive psychological stress.
Oh.
Any nursing student is at risk for an ulcer.
Nursing student, any nursing teacher.
Any nursing, yes. We're all at risk for ulcers.
We are.
Okay. So,
and then don't forget the infections with Helicobacter H. pylori.
All right.
Because that's been linked. Oh, you were just going to talk about it.
No, not really. You were.
Oh, was I going to? Okay. Yes. So H. pylori or Helicobacter pylori is a bacteria.
Really hardy one.
Very hardy, and it does live in the stomach.
Likes to set up home and
it does
camp
in that little acidic environment. Hard to believe. But so what happens is it can lead to peptic ulcers. And, of course, these little ulcers have been linked to cancer.
Yes. And so it takes multiple medications to get rid of that antibiotic. Or just like TB, it takes multiple antibiotics to get rid of that hardy bacteria. This is the same case we've got going on here. You might need more than one. Typically, you need more than one antibiotic if you are infected.
Proton pump inhibitor to go with it.
Yep, exactly. So we're going to move forward. It could be months, definitely over here. If you notice, it's going to be a long course of therapy. All right. Again, read about GERD, gastroesophageal reflux.
Of course, if you've ever been pregnant, you've probably had GERD.
And we do have some mothers in the class. So these are the common medications that you'll see, either 2 or more of these medications ordered for our clients, any combination. So H2 receptor antagonists, we talked about H1 and H2 already, didn't we?
We did. That was the histamine. Remember, we talked about the histamine antagonists that we use for sinuses.
So that's your H1 because you got one nose.
That's right.
But we're going to talk about your H2s when you're talking about going to the bathroom number 2. That helps them remember.
Help,
All right, proton pump inhibitors or PPIs, antacid antibiotics because they come in when we need to kill that H. pylori, etc. And all right, moving over here for nursing considerations. You can look over here. We want you to be familiar with this information. Sometimes I've seen clients where they go to the drugstore and buy an over-the-counter Zantac or ranitidine or something, and they think, I've got GERD, and they try to self-treat, and they don't really evaluate themselves, or they don't seek any kind of follow-up care. They don't have a doctor. They're not busy.
Problem with over-the-counter medication.
They're not safe.
They're not, and especially because with these antacids in that you can buy. If you ever read the label, it says do not take for more than
2 weeks.
Is it 2 weeks?
Yeah.
Without seeking attention from the doctor, because it could be something much worse than.
And it's right here. So persistent pain and heartburn may be symptoms of something serious. So if you're trying to self-medicate at home and your symptoms are not going away, don't just reach for the next antacid, or don't just say, I got to live with this. There could be something bigger going on. And we know that the earlier you catch these things, the better it is for outcomes.
Absolutely.
So also another reason is that medications are harmful in the body, particularly this one. Zantac can cause increased creatinine, your liver enzymes, etc. We don't expect you to know that, but what we want you to appreciate is that over-the-counter medications can cause harm, and clients might need to be evaluated. All right, moving forward. Next page.
The other thing, just to touch real quick, in a little box, it talks about how a lot of these drugs, like ranitidine or Zantac, have drug-drug interactions. It says ranitidine has fewer, but remember, a lot of these drugs change the acidity of the stomach. And as soon as you change the acidity of the stomach, then it's going to change the amount of time it takes for a drug to be absorbed.
Oh, right.
So remember, a lot of these drugs need to be given at a different time.
Yeah, separate and away from other medications. All right. So again, proton pump inhibitors. This is, if you've not heard of PPIs before, this is another medication. Again, read the nursing process. This is where we get a lot of our information. If you stumble across something in this section that you think, how do I teach this, or how do I help a client do this, post that question or ask that question. We'd like to help you. But proton pump inhibitors, here's an example here. Losec.
Or my mom's drug that she calls the miracle drug is pantoprazole or Panoloc.
Yeah. So these medications here, our job as nurses, careful monitoring of the client's condition, providing education as it relates to the medication. Generally, proton pump inhibitors are not used during pregnancy or lactation. And what else? Take medication before meals. I think this is a common thing that we need to help teach as nurses. If we're taking the medication with meals, then it doesn't have time to get in, set up, change the pH and all that before you introduce the introduce the food to the gastric system. So if this may be timed differently on your medication administration record. Typically, it'll be done 30 minutes before a meal, as you see down here. That's an important point to teach our clients. So they may forget.
Yes.
And then it's not really going to do anything. And it also takes a few weeks to set up and get therapeutic.
Right. And then the other thing to remember, so the proton pump inhibitors are the drug that we do see prescribed along with antibiotics to get rid of. So right down here, it says that they'll be combined with clarithromycin for the treatment of H. pylori. So again, monitoring for adverse effects. The big thing to remember is that it has been linked to stomach cancer as well, the proton pump inhibitors. So again, it's not a drug that you should be on for long term.
Yeah, so very important to ask your clients if they've had any GI upset or any changes in their symptoms or their bowel patterns, or are they requiring more medication than they used to require. So also don't crush or break or chew the medication. It needs to get into the stomach. Avoid smoking and alcohol and foods that cause gastric discomfort. Report any bleeding. I wonder why we'd want them to report any bleeding.
I wonder.
I'm pretty sure they're chuckling right now.
I think so.
I hope so. They might be falling asleep.
Yeah.
They're probably watching this at 11 o'clock at night.
Yeah,
maybe not.
Maybe.
Okay, so our role with any antacid therapy, careful monitoring of the client's condition, warn them. We have a few different kinds of antacids.
Yep.
Anything we want to tell them?
Okay, so let me think. The antacids, there's a list of them. Where did I see that list?
508?
Oh, yes, there it is.
Yep.
Aluminum hydroxide. If you scan that list, I'm sure you've, at one time or another, taken one of these. Remember with Milk of Mag, they actually use that as a little bit of a laxative, I guess you could call it. Malox. So Malox, anything with magnesium will cause diarrhea.
Right,
so
good
if
to know.
they're using it 4 or 5 times a day, they may have loose stools.
And then that's going to lead into electrolyte imbalances.
It is. And if they're taking enough of this magnesium, that could cause problems. And then calcium carbonate, remember, C, constipation. So calcium carbonate like Tums That can lead to constipation. And then the magnesium, of course, will cause diarrhea. So,
All right.
of course, we have Alka-Seltzer. So all those drugs work to lower the acidity in the stomach.
Right. Okay. And that helps usually relieve a little bit of symptoms here.
Yeah.
Here's your aluminum hydroxide or Amphigel. Have a read. Again, it's quite often prescribed for symptoms to relieve PUD. What's PUD stand for?
Not pelvic.
No. And GERD. All right. So when you see these medications, you can start to put together the clients have a history, or somewhere in their history they've had a diagnosis of maybe these things. And I'm going to move forward. The following antibiotics are commonly used for this purpose when you're going to combine antibiotic therapy. We talked about antibiotics last week, so amoxicillin, clarithromycin, Flagyl, tetracycline, Pepto-Bismol. Again, they all work on changing the environment. Pepto-Bismol changes the environment within the body and helps prevent the bacteria from actually adhering or sticking to the wall. Moving forward. And our chapter overview. Any key points that we want to stress? I think it's important that they know proton pump inhibitors need to be given 30 minutes before meals.
Yes, I think so too.
And then what about over-the-counter medications? Hopefully they remember what's important about symptoms and over-the-counter medications.
Yeah, not taking them for too long without getting properly diagnosed.
And it's important because that we understand this, because you'll be the ones out there working in the community interacting with clients. And then if you ask them, did your doctor prescribe that? And they say, no, I just buy it at the drugstore. You might want to evaluate how long they've been taking it. All right. So any last comments?
The only thing I was looking for was sulfurfate. I thought we usually covered sulfurfate. That's the one that coats the stomach.
Like Pepto-Bismol.
Yeah. So if there's already an ulcer there, it's going to coat. Yeah. I don't see that in the chapter though, but I thought we always talked about it.
I think we should show them an example of that next class.
Okay. Sounds good.
All right.